Welcome back. Young Americans are facing a mental health crisis. Earlier this month, the U.S. Surgeon General told Congress that youth mental health is the defining health issue of our time. One of the biggest factors fueling this crisis, social media. So Mary Jo Horton is here from Memorial Health. Welcome back, Mary Jo.
Thank you.
So this Wellness Wednesday, we are digging deeper into social media, the effect that it can have on teens. And you say it can affect them, their development
Yes.
of themselves, and how they pick up on others as well, right?
So if you think about how did you learn about who you were and what to be excited about, think about your teen years. And you would talk about like what you did and what you liked and the things that you were aspiring to.
Yeah.
Now social media has really prompted teens to talk about how they look, about wanting to be known, about wanting to be influencers. You know, that wasn't a thing.
Yeah, no.
And so it even changes their perception of how they view who they are as a person.
Because, you know, I thought when I was a teen in the 90s, we thought then that, you know, people think fame is too much. Too many people want to be famous, but that is on like steroids now.
They just think that you can be famous at any time. And also keep in mind, they're super aware that you can look at people's images that you don't know. I mean, the phone book back when I was in high school didn't have your photo.
There were no pictures. There were no pictures.
No.
All right, so you say there are connections between social media and anxiety, depression, even eating disorders.
Absolutely. You're so overly consumed about what other people think, not just of you, but of what you look like. And you think that everybody that you're looking at actually looks like that in real life.
And they don't.
They don't.
There's photo editing.
Yes.
They don't look like that.
No.
All right, so on the screen we have here some signs of dysfunctional or maladaptive use of social media. So let's go through these. Teens overly consumed with the opinions of others.
Correct. They can't stop talking about what Sally must have thought about them.
Yeah, that's not healthy. All right, significant distress when they don't have positive feedback.
Right. They don't like how many likes they didn't get on a photo, or they're not being told that they look good. And it's all this external validation that creates a lot of unhealthy patterns.
And because teens get into that, and I will say as an adult, there are some times, and I've looked, I'd be like, well, why didn't it get more likes than that? So if adults, we can feel that, teens.
100%.
Yeah. All right, so withdrawing and avoiding activities.
Right, they no longer want to go try something new. They no longer want to go around people that they're so overly worried about how they're going to come across that they end up isolating.
Okay, and then this last one, acts of self-harm and talks of suicide.
Yes, once you start hearing those should really be warning signs that we need to get help.
Okay, so you see these signs. These are the signs that you can look for. If you are seeing these signs, maybe not even all of them, but a few of them in your teens, let's go to the next full screen so we can talk about some strategies that their loved ones, caregivers can give them. Modeling healthy use of social media. Powerful,
yes,
you say.
You can't tell them that we're going to have electronic free time tonight as a family and then hop on your phone.
Yeah, so I've seen people like put the phones in a basket, but you have to do it too.
You have to do it too. You have to show them that you can also manage your anxiety around not having your phone next to you.
All right, that is a challenge for a lot of adults. I mean, yeah, okay. So open discussions about how your teen is internalizing feedback.
So this goes when a teen says, "I'm upset because so and so doesn't like me."
Yeah.
We don't want to say, "Oh, don't feel that way." We don't feel that. You don't feel that. That doesn't matter. We don't want to invalidate them. If that's how they're feeling, then that's how we're feeling. We need to have a discussion about it.
Because, you know, we do handle it that way. We say, well, don't you worry yourself with what they think about
or don't
you.
worry about
But
them,
it's not that
or don't
simple.
feel like that, or that's not needed. That's invalidating, and the only thing you've communicated is to not talk to me about it.
Okay. Set boundaries for social media use and stick to those boundaries.
Correct. So when they have the tantrum and they tell you you're ruining their whole life because they can't be on their iPad, let's not cave, let's be the adult.
That can be hard. I'm not a parent, but I hear that that's hard to do sometimes. Yes. All right, so seek professional help if hurting themselves or stop functioning. What do you mean by stop functioning?
So if all of a sudden their grades, their ability to eat, their ability to interact as a family, like they are no longer able to participate in active life, we need to get them help the same as if they had a physical ailment, which prevented them from functioning.
This is a complex issue
Yes.
because in that same Surgeon General advisory, he was saying, you know, there are some positives to social media,
Yes.
and we're kind of stuck with it right now.
So that you
right?
said it, right? That's the first part of we're stuck with it.
Yeah.
This idea that you're just going to get over that, or that wasn't important my time, or you'll figure it out. We really need to lean into the reality of it's here. How do we navigate in a way that can be helpful and entertaining?
And it is very real for our young people,
Yes.
for our teens. It can be real for adults too, but
Correct.
especially for them. Yeah.
It is their reality,
Yeah.
and by accepting it and having honest, open communication with them, maybe we'll learn about the third and fourth private account.
Yeah.
Oh,
Didn't
that's
even,
a whole other.
I didn't even think about that though.
Yeah, they're not telling you the truth.
The
You have really
secret
no
accounts.
idea what's happening.
No idea.
No.
Yeah, that's terrifying.
Yeah, we don't
It
know the
really
terms.
is. Yeah.
If we're honest. My age, I don't know all those terms.
Not a clue.
Not a
I don't.
clue.
Not a clue.
No.
Okay. Mary Jo, thank you so much. And we want to say there, it's on the bottom of your screen, if you or someone you know is having suicidal thoughts, if you need help, you can call or text 988. That's the Suicide and Crisis Lifeline.